I'd like to welcome everyone to the NNLM Health Misinformation Symposium. Next slide, please, Margie. Before we get started, I have a few technical items to get covered. All attendees have been muted, but we do welcome your comments in the Zoom chat at any time. Due to Kyla's limitations today, time limitations, we won't be able to have a Q&A after this session. NNLM staff will be keeping an eye on the chat with me during this session. Please be sure to select the Everyone from the drop-down menu when posting your comments or questions in chat to ensure that everyone sees them. You can also send them directly to the hosts and the panelists. We have live closed captioners for this event. You can access closed captions by clicking on the icon with the 3 dots and then selecting closed caption. If you would like to share questions or comments or observations on social media, we encourage you to use the hashtag for this event, Health Misinfo NNLM. Before we get into the depth of the conversation, I would like to share a little bit about who we are. The National Institutes of Health is the nation's leading medical research agency. Many of you may be more familiar with the National Centergy for Allergy and Infectious Diseases, which is one of the many institutes and centers at NIH. NLM, or the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources such as PubMed and Medline Plus. NNLM, the National Library of Medicine, is one of the 27 institutes and offices at the National Institute of Health, and it's the world's largest biomedical library. Oops, I'm sorry, I got off track. NNLM is an outreach program of NLM working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries and 3 national offices, 4 national centers, all providing training, funding, engagement opportunities for over 9,000 NNLM member organizations. Next slide, please, Margie. All right. Hello and welcome. I want to thank you for your time and attention for this event. I know many things demand our time and attention these days, and I hope you will be able to be fully present for each session you choose to attend over the next 3 days. My name is Bobby Newman. My pronouns are she, her, and hers. I am the chair of the organizing committee for this event, and I am the community engagement and outreach specialist at the network of the National Library of Medicine Region 6 office at the University of Iowa. I want to thank the planning committee for their guidance and assistance in planning this event. I want to thank the presenters who responded promptly to the invitation to the symposium. And I want to thank the people who have registered for the event. There are almost 1,600 live attendees. These numbers are a credit to our speakers and the planning committee. Finally, I want to thank the NNLM staff members who volunteered to help here today. Along with the VFAIR's technical support experts, NNLM staff will watch over chat, manage the Q&A for our sessions, share links and essential information in chat. With that, I would like to introduce Linda Walton, Associate Director and PI for Region 6 at the University of Iowa. Linda is the 2023 recipient of the Marcia C. Noyes Award from the Medical Library Association. The award recognizes a career that has resulted in a lasting, outstanding contributions to the medical librarianship profession. Linda?
Good morning, and thank you, Bobby. Welcome to the Health Misinformation Symposium, hosted by the network of the National Library of Medicine. With the rise of the internet and social media, access to health information has become more widespread than ever before. However, this also means that misinformation about health and medical topics is more prevalent than ever. Health misinformation can have dangerous consequences, leading to the spread of false information and potentially harmful practices. This symposium is a platform for healthcare professionals, researchers, librarians, and other stakeholders to come together and explore the issue of health misinformation. Through a series of presentations, discussions, and workshops, we will examine together the impact of health misinformation on public health, strategies for combating it, and the role of libraries and other information professionals in promoting accurate health information. Our speakers and panelists will bring their expertise and experience to the table, sharing insights on topics such as the psychology behind belief in health misinformation, the ethics of debunking false information, and the importance of health literacy in empowering individuals to make informed decisions about their health. We hope that this symposium will provide a valuable forum for attendees to learn from each other, exchange ideas, and collaborate on ways to promote accurate health information and combat health misinformation. Thank you for joining us for this critical discussion. Together, we can work towards a healthier, more informed society. Health misinformation is not a new phenomenon. Throughout history, people have sought out remedies for their ailments, often turning to sources that are not scientifically proven and potentially harmful. For example, in ancient times, people used substances like lead and mercury to treat illnesses without understanding the harmful effects these materials could have on the body. As medical knowledge and understanding developed, so did the ways health information was disseminated. In the early 20th century, newspapers and magazines were a common source of health information for the general public, but the accuracy of this information was not always reliable. This was particularly evident during epidemics like the Spanish flu, where misinformation about the disease and its treatment was rampant. With the rise of the internet and social media, access to health information has become more widespread than ever. However, this has also led to increased health misinformation, which can be particularly dangerous. For example, misinformation about vaccines has decreased vaccination rates, which led to the resurgence of diseases like measles and polio. Similarly, misinformation about COVID-19 can lead to a lack of adherence to public health guidelines, potentially leading to more cases and deaths. There are a number of factors that contribute to the spread of health misinformation. One is the human tendency to believe in things that are familiar or that confirm our pre-existing beliefs, even if they are not supported by scientific evidence. Additionally, the internet and social media algorithms can create echo chambers where people are exposed to information that confirms their beliefs and are shielded from opposing views. Addressing health misinformation is crucial for promoting public health and ensuring that people have access to accurate and reliable information. Libraries, medical professionals, and other information professionals have an essential role to play in combating health misinformation. By providing access to reliable sources of information and promoting health literacy. This can involve initiatives like fact-checking resources, developing digital literacy programs, and partnering with community organizations to provide accurate health information. Health misinformation has a long and complex history, and its impact can be particularly harmful in the internet and social media age. Addressing health misinformation is crucial for promoting public health and ensuring that people have access to accurate and reliable information. By working together and leveraging the resources available, we can combat health misinformation and work towards a healthier and more informed society. And with that, I will turn this back over to Marty Shepard to introduce our keynote speaker.
Well, thank you very much, Linda, and thank you very much, Bobby, for kicking off our symposium. So it is my pleasure to introduce today's keynote speaker for the rest of the day. Kyla Fullenwider is from the Office of the Surgeon General. Kyla is a senior advisor in the Office of the Surgeon General, where she leads a portfolio of work at the intersection of public health, technology, and health misinformation. Previously, she was a fellow at Georgetown's Beek Center for Social Impact and Innovation and was the in-resident entrepreneurial fellow at the Shorenstein Center on Media, Politics, and Public Policy at the Harvard Kennedy School, where she studied the impacts of the online misinformation environment on our democratic institutions, including the nation's first online census. Kyla served as the first Chief Innovation Officer at the U.S. Census Bureau and founded the Census Open Innovation Labs, laying the groundwork for the first trust and safety team in the U.S. government. Prior to the U.S. Census Bureau, she served as a White House Presidential Innovation Fellow. Her work and writing have been featured in the New York Times, LA Times, New York Magazine, and Fast Company, and in case studies authored by the Harvard School of Business and Annie E. Casey Foundation. Kyla will be talking about building a health information environment, exploring the Surgeon General's advisory and community toolkit on health information. I'm going to go ahead now and switch over to Kyla's slide deck and we'll get started. Hey.
Wonderful. Thank you so much, Margie. Can everybody hear me okay?
Pretty good. Yeah. Maybe a
Okay.
little bit louder. Yeah.
Okay.
Okay.
Great. Well, thank you so much for inviting me to be with you today. My name is Kyla Fullenwider, and I am a senior advisor at the Office of the Surgeon General, where I work with our U.S. Surgeon General, Dr. Murthy. And it's just really, really lovely and wonderful to be with all of you today. Next slide, please. Fantastic. So today I am going to spend the bulk of our time together talking about two resources that our office has produced on building a healthier information environment and addressing health misinformation. So the first is on the left here, the Surgeon General's advisory confronting health misinformation, and on the right, a community toolkit for addressing health misinformation. Next slide.
Sorry, just let me reboot here.
No problem.
Okay, can you see your slide?
I can. It's a little far away.
Yeah, hold on just a minute. Let
okay.
me stop here and get it set up right. Sorry about that.
No problem.
Sorry, my fault. Too many things open here. Back to yours. Okay, let me get back there. There, how's that?
All right, wonderful.
Now we'll move
Thank
on.
you. Great. And so if you can just go to the next slide.
Yeah.
Perfect. So this is just another look at the Surgeon General's advisory. So I'm sure many of you saw the statistic from the Kaiser Foundation in 2021 that showed that nearly 80% of adults in the US believed or were unsure of, excuse me, whether to believe false statements about COVID-19. And we saw this data too. And this was very concerning to Dr. Murthy. And so in 2021, we issued what would be the first Surgeon General's advisory of his tenure. And Dr. Murthy saw COVID misinformation and health misinformation more broadly as an immediate threat to the nation's health. And so that in many ways is what prompted our office to release the first of these two resources. And this came out in July of 2021. Go to the next slide. All right, so what is a Surgeon General's advisory? You may have heard the term, but weren't particularly familiar with it. So just to start out with some definitions here, a Surgeon General's advisory is a public statement that calls the American people's attention to a public issue or a public health issue that and provides recommendations for how that issue should be addressed. And advisories are reserved for significant public health challenges that need the public's immediate awareness, right? And so that's a key phrase here, the immediate awareness of the public. This advisory, as I mentioned, was issued in July 2021, and it calls for what we described as a whole of society approach to addressing health misinformation. And that was in part our recognizing that the complexity of this problem really was going to require a cross-section of society to address it, and not just one sector of society. And that whole of society framework, which if you've explored the advisory or haven't, it includes sets of recommendations for each of those different groups or actors. So sets of recommendations for individuals, families, and communities, for educators and educational institutions, journalists and media organizations, technology platforms, researchers, research institutions, funders and foundations, governments, and then of course, health professionals and organizations. Next slide. Great. And so what specifically did we recommend in terms of this whole of society effort? So for each of these groups, we did a pretty significant deep dive. And I'm going to touch on the one specifically around educators in just a second, but just to give you a sense at a high level of what was included in that set of recommendations. So equipping Americans with the tools to identify misinformation, to be able to make informed decisions about what they share, and address health misinformation in their communities with trusted local leaders. And on that one in particular, for individuals and communities, we developed another resource, which is this toolkit I mentioned earlier, and I'm going to dive into a little bit more later. In terms of research, we recommended that research be expanded that deepens our understanding of health misinformation, including how it spreads and evolves, how and why it impacts people, who is most susceptible, and which strategies and interventions are most effective in addressing it. Implementing product design and policy changes on technology platforms to slow the spread of misinformation. Investing in longer-term efforts to build resilience against health misinformation, such as media science, digital literacy, health literacy, and trainings for health practitioners, journalists, librarians, and others. And thinking of this as a sort of lifelong learning endeavor, really. And then finally, convening federal, state, local, territorial, tribal, private, nonprofit research partners, this whole of society sort of effort to explore the impacts, identifying best practices, issuing recommendations, and then finding common ground on difficult questions, including what appropriate legal and regulatory measures might be that also still protect user privacy and freedom of expression. Next slide. And so among those recommendations, we had a specific set of recommendations that I want to kind of spend a little bit of time on right now for educators and educational institutions. So there are three sort of priorities we outlined here. The first being strengthen and scale the use of evidence-based educational programs that build resilience to misinformation. So media, science, digital data, and health literacy programs should be implemented across all educational settings, including elementary, secondary, post-secondary, and community settings. And in addition to teaching people how to be more discerning about the credibility of news and other content, educators should cover a broad set of topics, such as information overload, internet and infrastructure, the challenges of content moderation, the impact of algorithms on digital outputs, algorithmic bias, artificial intelligence, AI-generated misinformation, visual verification skills, and how to talk to friends and family who are sharing misinformation. And what we really wanted to do with that recommendation was at least start to get at the complexity of the information environment that we all live in now, and recognizing that a sort of out of the box info literacy program may not be enough, right? And that this technological landscape technological information landscape that we're in now is changing at such a speed that information literacy programs also have to change at that same speed. And I'm sure many of you are familiar with the conversations around generative AI and ChatGPT-4, which only further, I think, emphasizes this point. The next one, and we'll actually touch on this again with the toolkit, is around educating students and the public on common tactics used by those who intentionally spread misinformation, or in this case, disinformation online. And this is a really important point, because there's you may have noticed in the literature that it is hard to find research on interventions that are consistently effective. However, research on this particular topic is strong, and that is that it suggests that teaching people how to spot tactics will actually reduce people's willingness to share misinformation. Examples of tactics used by those who deny scientific consensus on health issues include presenting unqualified people as experts, misleading consumers with logical fallacies, setting impossible expectations for scientific research, cherry picking data, which is a very, very common disinformation tactic, and introducing conspiracy theories. Again, teaching people the common tactics of disinformation is one of the best inoculation tools that we know of right now. And finally, metrics, right? And so much of this comes down to metrics, so that we actually know what's working, what's not. And so the third recommendation here is to establish quality metrics to assess progress in information literacy. So while there is substantial media and info literacy work being carried out, we definitely need more consistent and empirically evaluated materials and practices, so that we can continue building on the great work that's being done. Next slide, please. Great. And so the advisory was a really important tool for starting to talk about and start to have the conversation around the health impacts of misinformation, and particularly with a sort of more expert audience, if you will. But what we kept hearing again and again from the public is that this issue wasn't just an issue in theory. It was an issue that people were dealing with daily in their lives in many cases, whether it was a teacher or a health provider or a faith leader. And so it really was what I often call a kitchen table and clinic room issue. So that is something that people were dealing with in the context of their everyday lives. And therefore they needed something that was practical and something that they could actually use. And so this sort of need was in many ways the impetus for creating the community toolkit for addressing health misinformation. Next slide, please. Oh, I think, let's see. Oh, sorry, I'm sorry, can you go back? Sorry about that, perfect. I just wanted to touch on who this is for. So again, whereas a Surgeon General's advisory is often read by experts or policymakers, the media, et cetera, it doesn't always, Surgeon General's reports don't always trickle down at the community level. And so we had a very specific, I think I lost myself. Okay, so we had a very specific audience in mind with the community toolkit, which you can see here on the right, and we really wanted to call that out for people. So teachers, librarians, we specifically call out community leaders, faith leaders, healthcare providers. These were actually the people that we were hearing from, right? We were getting emails from, we were getting, we were having conversations with, who were looking for a resource that they could use in and with their communities. And so the content that you see here on the left was very much informed by those conversations that we had with those folks. So for example, when we first started the process of creating the toolkit, we started out with something that was pretty text heavy. And in some ways wasn't that far off, frankly, from the advisory. And then we ended up with a document that was much more visually engaging, much more interactive, and much more hands-on, as you'll see in just a minute. Next slide. Great. So I want to walk you through a few of the exercises and games and infographics that are in the toolkit so you can get a sense of what's in there. And keeping in mind, again, that we created this for, really those trusted messengers in communities, those trusted voices, those trusted leaders in communities to be able to use in that context. And so we started with the basics, right? So learning what some of the most common types of misinformation are. And so here, what you see is an infographic sort of laying those out. So the first one here is pointing to memes, right? So just those sort of fun, colorful images that were in many cases just created as a joke, but then people start resharing thinking that they're true. The next one, websites that look professional, and they're often designed, in fact, to look like news sites. But then the stories are false or misleading, and they have often very sensational or sort of clickbaity headlines designed to make us click on them. Quotations where the beginning or end has been deleted to sort of change the meaning or decontextualize it. So the person might have said that, but without the full context, it's really not a fair representation of what they said. A classic one, which I'm sure many of us have seen before, just cherry pick statistics, right? So where we have a situation where someone has chosen the number that supports what it is that they want to argue, but without all of the data, they haven't really provided the full context. And that one is also sort of in the same family as misleading graphs or diagrams, which I'm sure many of you are familiar with from the pandemic, but that often look official, but then again, they're not resourced properly or in fact don't tell the real story. Another common type of misinformation, old images that recirculate as if they're actually very recent. And then finally, and this has become even more of a concern with the emergence of more sophisticated AI, videos that have either been edited or are in fact just AI generated altogether. And so this is really a useful place to start when you're educating folks, because many times people don't realize that a study or a data point that they've been using or heard may have in fact been picked to make an unsubstantiated claim, or that an image has been taken out of context. And how many of us have actually shared one of these without in fact checking the accuracy? And maybe not this crowd actually, but I think it's more common than we realize. Okay, next slide, please. Great. So this section is based on the behavioral science around why misinformation is shared and why it can be so tempting. And so the points we make here are that I think largely, misinformation, we point out, is not shared to cause harm, right? Of course, disinformation campaigns are ever present, but in fact, it's because, in some cases, we like to feel that we have new information. Or in other cases, and, Dr. Murthy hears about this a lot, our office hears about this all the time, we actually think that we are sharing information that can help people. This often happens with a new diagnosis, a new scary diagnosis. People can get inundated with resources from friends and family who are legitimately trying to help, but are just sharing, unhelpful information. And this leads to this next point here, which is we may be seeking explanations or wanting to share information that helps us make sense of events. So that could be, again, in the case of a recent diagnosis, or in the case of the last few years, a global pandemic. And then finally, this last one, and this is an important one, And we saw this and heard this time and time again. And so that we want to feel connected with each other. So, many folks build communities around some of these narratives, and that is very much the case. Was very much the case throughout the pandemic. So, in any case, we wanted to sort of make the point here that in fact, many of us may share misinformation without the intent, of course, to cause harm. And that was a point we wanted to make sort of throughout the toolkit. Next slide. Great. So this slide, this is actually one of my favorites. It looks at the spectrum of why people share misinformation, ranging from, like I said, the truly benign, just generally wanting to share something that you think might be helpful. For example, a friend or family member that has a new diagnosis that's confusing or scary, to the very harmful, right? So that's, intentional sharing of disinformation with the intention to harm. And this spectrum, I think, is quite helpful because, again, it shows that many of us share misinformation without meaning to cause harm and, in fact, wanting to help. And that it often isn't just someone else doing it, but in fact, it might be us. And so, again, trying to drive the whole point home here about being more thoughtful about what we're sharing online and really checking our resources. Next slide. Great. So if you remember the start of the toolkit overview, it's broken up into two sections. So the first section we just kind of went through, and then the second section is really a series of interactive tools that we wanted to be something that could either stand alone, right? So you could literally print these out as worksheets if you wanted to, or even integrate it all into, for example, a curriculum. And so I want to walk you through a few of the examples here. Next slide. Great. So this is a comic strip. Again, in the spirit of wanting to make this toolkit as visually engaging, as interactive as possible. We have a comic strip. We had this hand illustrated in-house with our wonderful designer Hannah Kim. And so this comic strip essentially brings the reader through a situation where a family member has been diagnosed with a serious illness and walks you through a scenario and all the moments where they might be vulnerable to health misinformation. And then the next section actually walks you through like how you might respond, where there might be points of intervention, using some of the best practices. Next slide. Great. This next section has been hugely popular. So you can probably imagine why, just by looking at it. But here we bring the reader through the process of learning how to talk about health misinformation with a family member or friend. And it has specific pop-out boxes, if you can see there, with tips about sort of what to do and in some cases what to avoid. And so if you note here on the first slide, we talk about the importance of listening. The best way to change someone's mind or engage around misinformation is to just listen to them to start and try to understand why they believe what they do. The second point here is around empathizing and empathy. And so when talking with a family member or friend, emphasizing the fact that you understand and that there are often reasons why people find it difficult to trust certain sources of information. So not judging, of course, and not fact checking in the context of a conversation like this. Point number 3 here is if you have an opportunity through listening, through connecting with that person, you then can have the opportunity to point to credible sources. So underscoring that, of course, it can be hard to find accurate information, especially during events like a global pandemic, but that there are resources out there and in fact, pointing to some that you use yourself. And then finally, this last final page here, and in some cases, of course, this goes without saying, but unfortunately, it's more common than you might think, which is sort of public shaming of people. So getting in someone's comments online or on their various social media channels and sort of calling them out or fact checking them, which doesn't work. And so, in those cases, ideally you want to either have a conversation directly with somebody, or if you're online, via direct messages rather than sort of in their comment section. And then finally, using inclusive language, which of course goes back to the more empathetic approach to addressing health misinformation in and with a community member, somebody that you know personally. Next slide. So I touched on this earlier because the research continues to be strong here, and whereas in other areas it's maybe not as strong in terms of interventions, and that is really showing people the common tactics that are used to manipulate the information environment. And again, research has shown this to be one of the most effective tools in teaching people about misinformation and disinformation. So literally showing them the tactics. And it turns out that most people don't like to be a mark, right? And so showing how this is done, it effectively sort of pulls the curtain back, shows the magic tricks. There are other even more games that I've seen where participants are actually asked to play the role of the disinformation agent and actually create a disinformation campaign. And so, pointing to these tactics here, which are very common, right? So including the logo of an established organization like the CDC on a website or a document that's being shared. Using visual cues, for example, someone wearing a white coat or holding a stethoscope who may in fact not be a healthcare provider. Again, creating those professional slick websites so that our visual cue is one of trustworthiness, when in fact, much of what is there might even be trying to just sell a supplement or a product. Including something that sort of gets at insider information. For example, my brother works for the government and has inside knowledge, or my sister is a nurse at the ICU and tells me something that no one else knows. Using unique or rare terms so that when someone searches for content connected to that term, there are fewer links, and therefore it is less likely that there will be available fact checks or debunked. And this is a real problem around sort of information voids. And then finally, creating content that looks like a first-person experience. It's very difficult to fact check what somebody says. For example, this particular side effect happened to me, or this particular miracle happened to me, right? So those trying to push disinformation will therefore create content that looks like real life stories from people when it's really, in fact, all fabricated. And if you recall, there were many of these sort of testimonial videos being shared across social media during COVID-19 that were in fact debunked, but not before millions and millions of people saw them. Next slide, please. There we go. Thanks. Finally, I just wanted to just point out a couple of resources for you here. This is a great just summary document that we pulled together some of the most critical points from the toolkit. We actually have this in addition to 8.5 by 11 size as a poster, which I will make a plug for because I think they're wonderful. So these can be printed out and used in various venues, whether it's a doctor's office or a waiting room or a library or a classroom. We had that in mind when we created them. If you go to the next slide. And are you able to click on that? If you click on teaching slides, if it will bring up the actual website? If not, I can just link to it. No, that's okay.
Yeah. Okay.
Yeah, so I just wanted to point out a really fantastic resource that I'm very excited about. So if you go to surgeongeneral.gov, you'll see the priorities pages, and you just click on misinformation, you scroll down, and you'll see a wealth of health misinformation resources. And in particular, there's a set of what we call teaching slides that is essentially a PowerPoint presentation version of the toolkit. So the toolkit is great and useful, and it's a PDF, and I should mention it's also available in Spanish. So we have it in English and Spanish. The teaching slides, however, we created them with the user very much in mind. So we wanted to have something that somebody could truly just put up on a screen and use out of the gate. And so we even have presenter notes with them. We've broken down those interactive exercises that I just kind of showed you in like infographic form, in really interactive sort of slide by slide process. And it's a really phenomenal resource. It's totally, open source and available for you to use as you like. And we have heard from folks who have been using it that they've been using it in many different ways, adapting it, integrating it into work that they already have on this topic. So just wanted to flag that for you and share that as an additional resource that our office has created for the public. And with that, I think I'll wrap up. Thank you so much.
Yeah, I can try to put that up if you'd like. That
Sure.
let me
Yeah,
show
if you
it.
have a minute. That
Yeah,
would be
I do.
great.
Oh, absolutely. Let me
Okay.
stop here.
And Margie and Kyla, I did drop that link and several others in the chat while you were talking.
Okay, great.
But Margie, if you want to put that up.
Yeah, I will. Let me get over there and do that.
And I just want to remind everyone that due to the restrictions on Kyla's time today, we don't have time for Q&A after this session. I saw some great questions and comments happening in the chat box, and I think you will find answers to those in some of the sessions that are happening over the next 3 days. I also want to remind everyone that sessions are being recorded and will be available online probably about a week after the event. I know we have concurrent sessions happening and you may not get to attend every session you're interested in. So that is a great way to catch up on the ones that you missed.
Okay. Let me.
And I have to say, Kyla, I love this toolkit. I've been just very happy with this one and the well-being one, which is not related to this event, but both that have been put out from the Surgeon General's office, both the content and the design of the website, I think are really great.
Oh, great. Thank you. I will be sure to share that back with our design team. They're phenomenal. Our in-house design team is really incredible. Great. Thanks so much for pulling this up. So really, I just wanted to just kind of scroll through here. You'll see how the content that I just discussed in the toolkit is broken down in a very user-friendly kind of presentation format that allows you to actually teach this in a classroom setting or a clinic setting, library setting, however you might use it. You just kind of go to the next slide. Sure.
Oh yeah, they're really great. This is good.
Yeah, and if you go, keep going down a little bit more.
Okay.
Okay, so this is a great example. I'll just show this one and then we can stop. But so if you recall the infographic I showed you earlier around common types of health misinformation. So what we did with each of those infographics is we broke them down into sort of step-by-step exercise that you could walk through in a classroom setting or a presentation setting. So here we have what types of health misinformation exist. Go online and see if you can find any of these common types of health misinformation. And then we go through each one per slide.
Yeah.
And so this is the kind of how functionally different the teaching slides are so that you can actually use them in a teaching setting. And we wanted that to be available for folks because the toolkit is harder to use in that way. So And so the rest of the document is designed pretty much like this. And then it sets you up for discussion that you can have with your audience, with your group.
Yeah, it's really packed with a lot of good resources here. So great.
Perfect. Wonderful. Thank you so much for sharing that. And and if there are questions, feel free to share my email and reach out directly. Happy to follow up. I'm sorry I couldn't stay for the full Q&A session today.
Well, we appreciate you being here with us, and it really is a great way for us to kick off our symposium and share a tool that can be used by almost anyone that's trying to inform or, just share a different message in a different way. So it's sensitive, and it, it really helps people learn how to just talk about it. So I really, truly, truly do appreciate you taking your time and being with us, and having, someone from the Surgeon General's office to help us just share the message that's coming from that great office. Has just been really, really helpful. And really, we really, really thank you so much for being here with us. Truly do. So
thank you so much, and have a great conference.
We will do that. Before everyone leaves, we do have just a few more things to go over. Let me get back to our slide deck. Okay, so we just have just a few things to share before we end this session, and we'll give you a little extra time for you to have a break before we begin. But first of all, if you're interested in claiming medical library continuing education or certified health education specialist credit, or the CPHCE credit for this session and others, you'll receive an email after the symposium ends with a questionnaire and instructions on how to claim the CE. And before we wrap up, I do want to encourage you to join the network. Membership is membership for organization is for organizations and not individuals, and it offers benefits such as funding opportunities as well as print resources. So please take time to check that out if your organization is not already a member. We love to talk about what NNLM does and all the opportunities that are available for you and your organization. So we do have about 40 minutes before our next session. So we would like to encourage you to tour the platform and visit one of the booths for the event. It's a great way to kind of just learn what's going on with misinformation, and to just kind of explore what we've been building over the last few months for this event. I also want to encourage you to get outside, stretch. If it's a nice day out, go outside, take a walk. And we look forward to seeing you in our next session at 1:30 p.m. Eastern. And just want to also give a plug for one of our new misinformation series that's beginning in about 10 days. So please join us for some of the upcoming sessions for our health misinformation webinar series. This series does feature presentations from expert guest speakers, and will enable librarians, public health professionals, health educators, and healthcare providers to explore various aspects of health misinformation, disinformation, and malinformation, and learn practical and evidence-based solutions for how to identify it and help curb its spread. These presentations will be scheduled intermittently throughout the year, so you can learn about what's coming along by checking out the NNLM training calendar. And you can see the dates. The July date has been set. I just didn't have time to update the slide. So please take time to go onto our training calendar and sign up for any of those very interesting upcoming sessions. So thank you so much. We really appreciate your attention. And we will see you at the next session. Thank you so much.